Okay, so my opening remarks, I think, are about 3 minutes. And so I'm going to start now because it's 1:02. We'll let people join in. And if you do miss any part of the presentation, we will be sending out the information we have here, and we'll be making the recording available. But to start it off, I think you have to start off all of these conferences with thanking everyone who's doing the excellent work that are keeping people safe. And I think that starts with the provincial government and Minister McNaughton under his leadership. They've kept a lot of workers safe, and certainly they've been able to help us do incredible work in construction. Minister McNaughton wouldn't be able to do that without the guidance and help of the Chief Prevention Officer, Ron Koletsky. And so as always, we're very happy to have him on this webinar. There's other safety partners that we need to thank, including the IHSA, but we also really need to thank and focus some attention on all the health and safety professionals who are on this call but do the work day to day on the site. COVID-19 is all about implementing. I think a lot of the times we have the answers, but it comes down to implementation, and we can't implement without the role of health and safety professionals in the industry, including joint health and safety committees, because this is really a tripartite effort between government, labor, including workers and unions, as well as employers and management. This webinar is essentially brought to you in partnership with, pretty much the whole construction industry. And so I would like to recognize the efforts of the Sewer and Water Main Association, ORBA, OGCA, HCAT, OHBA, BUILD, and ORCA, which is a collection of residential and infrastructure related subtrades. So getting into it, each wave has been different. In the first wave, we were focused on figuring out what to do and how do we keep workers safe, ramping up the supplies of PPE, creating policies and implementing them, focusing on procedures and gathering information on the virus. The second wave was about fighting complacency. Essentially, we knew what we needed to do, but we needed to do it better. And we also had to battle the elements, including the winter. This third wave, the virus is mutating and our response is adapting. And so we've been able to add rapid testing. We now have support coming in the form of vaccines, but we can't rest on our laurels, and help is coming, but we have to hold the line until it gets here. I think you're going to hear this more than once today. A really important thing to note is the first available vaccine is the right vaccine for you, for your workers, for anybody. So if you can get a vaccine, or if you can help your workers get vaccines, that's the vaccine that you need. Today's event has 3 excellent speakers, and we'll introduce them individually, but the focus is on protecting workers and helping workers get vaccinated. And the main tool that we see in order to accomplish that is through communication. So protection, as we all know, there has to be a continued and dare I say enhanced focus on PPE, social distancing, enhanced screening, if available, that includes rapid testing. But most importantly, we need to focus on avoiding errors. It is really easy to let your guard down, whether it's before or after work, whether it's during lunch, whether it's in a site trailer, whether it's in the office. This is your best friend. It's a mask. There's no reason you have to take it off. If you want to wear 2, that's even better. The second one is vaccination, and we do have 2 speakers who are going to talk about this today, potentially all 3 will. Supplies are ramping up. There's been a lot of vaccinations, so supply is an issue, and we'll hear about that. But right now in the province of Ontario, for sure, everybody 55 and over has access to vaccines in the province. In hotspots, and we're going to hear about this today, the program's going to be expanded, and I'm interested in hearing what the plan is going forward. Finally, we need to communicate. We have the answers, but we need to communicate them. We also need to listen to what the existing barriers are, and we need to come together as employers, as labor, as workers, as government, and we need to address them. We need to focus on what works, including the use of the COVID-19 alert app. If more people downloaded it and used it, it would help. But without further ado, I'm going to turn it over to Amina now, and she's going to introduce our first speaker.
Thanks, Andrew. Our first speaker is Ron Koletsky. Ron Koletsky is Ontario's Chief Prevention Officer, also known as the CPO. The CPO oversees the prevention office within the Ministry of Labor, Training, and Skills Development. Under the CPO's leadership, the Prevention Office has supported workplaces in Ontario to implement health and safety measures during COVID-19. This has included working on cross-government and industry committees and producing over 200 workplace guidance resources, which have been viewed over 1 million times and continue to be updated today. Welcome, Ron.
Thank you, Amina. Welcome, everybody. Thank you, RESCON, for your leadership, Andrew and Richard, and for the associations participating. Andrew pretty much summed up everything I was going to say. It's all about leadership. B, staying informed and sharing information. And especially right now through this wave, given the virulent nature of and transmission rate of this of these variants, we and I've said this before, we need to stay vigilant, and we need to ensure that our workers are informed, our employees are informed, not only about the continuation of safe practices while they're at work, but also employers providing them with information on what they need to do when they're not at work. We have identified the areas of concern on sites, particularly it's either not wearing or improper wearing of masking, not following the infection prevention and control rules, carpooling, breaks, lunches, that type of thing. Now, the ministry, there's a couple of things that are happening. One is, as Amina had indicated, we are continuing to update the guidance material on a regular basis because things are very rapidly changing. We will be issuing guidance materials on rapid testing. They've just been approved, as well as guidance material for employers on vaccinations. The one thing that we are stressing right now is, there's a false sense of security if someone gets vaccinated. Remember, it's the first vaccination, but you can still get it and you can still spread it. We have to continue all the protections that we've been relaying to people, employers and employees over the past year and a bit, that until somebody stands on a chair and says this thing's over, it's not over. So when you get your vaccination, there are still incidents where people still can get sick, they can still transmit, and you can still bring it in the workplace. There's a lot of, obviously a lot of activity in the media right now about reporting, the accuracy of reporting. Certainly the Globe and Mail had a large expose the other day on the WSIB statistics. We're trying to look at things from a holistic point of view when it comes to construction. Firstly, yes, there's been roughly about 26,000 claims processed, of which construction is roughly a little bit less than 1% of those numbers. We also know that through our rapid testing experience, we've probably shipped over 200,000 rapid tests to the industry since the beginning of rapid testing, both in the pilot and throughout this period where we're trying to expand. The last few days, there's been an heightened interest within the industry for, I think we've probably got 6 or 7 more inquiries from fairly large constructors and associations to participate, which is good. There's still a lot of tests available. We're looking at new ways and innovations on how to issue the rapid testing. As you know, the initial testing required a regulated health professional. That's been relaxed quite significantly, where it's a trained person with a healthcare background, whether that's first aid or retired persons that have been in the industry. So, rapid testing is telling us that over the past couple of weeks, the actual number of persons that have been testing through the rapid screening process has increased. Now, we do know that rapid screening has a bit of a false positivity rate. It's about 25% false positive, but nonetheless, it's still catching 75% of those when they have to do a PCR test as a follow-up. So we do know that the variant is coming in, and as we can see in Ontario, that it's upwards. I believe today it was like 4,100. So we're still in a period of significant concern. But the positive note is that if we continue to communicate and continue to provide information, then hopefully that we will minimize the exposures within the construction industry and be able to remain open as we have. The other thing that we're starting to look at is, and perhaps as more science and public health information becomes available, that we may be in a position where just masking alone is not sufficient. And what we're finding is if people cannot guarantee at all that they can physical distance within the 2 meters, and they are working alongside people for a frequent period of time, that eye protection may be necessary or will be necessary. So those things will come. We will be updating the guidance on those materials as it occurs. We are also doing an inspection blitz with our Ministry of Labor, Training and Skills Development, in partnership with ourselves, is doing the compliance bits within the industry. And that's either based on a proactive or a reactive complaint-driven process. What we're really finding in the number of orders that we're issuing, it's really people have relaxed their vigilance. They've not wearing a mask, or wearing the mask improperly, or not having the resources available to adequately sanitize. So again, it's really important that as an industry we continue with the good reputation that we have with respect to that. The other thing that's happening, and perhaps Dr. Heyer will speak about it, we've had discussions, obviously, over the past couple of weeks. Construction was included as the essential workers group in the phase 2 number. And I thank RESCON and OGCA and Build and others for helping come up with the wording to work with Dr. Heyer's group and the Vaccination Task Force to include construction and infrastructure within the guidance. But as things have materialized with respect to the evolution or the development of hotspots across different parts of our community, and we've seen through the release of postal codes that a number of those hotspots actually involve areas of construction. And so we are working with the Ministry of Health and Public Health in the determination of some constructors have offered their support to not only provide vaccination capacity for their own workers, because there has been an outbreak in those sites, but also making available those areas around it to do a community vaccination as well. So this is still in the evolution phase. There is also a number of pilot initiatives being tried. There was one in Windsor, or in Waterloo, Kitchener this past couple of days, involving a bus, a mobile vaccination clinic, as well as the provision to provide rapid screening tests to small business. So we're looking at those within the industry. Some of the construction associations that represent some of the smaller constructors out there have inquired. So we want to take a look at that. It's interesting. Ministry of Labor isn't traditionally a ministry like the Economic Development, Job Creation and Trade that looks after manufacturing and retail, and Northern Development and Mines looks after mines. Well, the Ministry of Labor, I think it's because of our close relationship and that of the minister with the construction industry, that we took on being the champion of supporting construction throughout this period. So we will continue to do that and continue to work with our colleagues at the Ministry of Health, Public Health and Vaccination Task Force to be able to get you the information that you need. Just to make some additional information available, there is Infectious prevention and control, half an hour learning session that is free, that's been made available. It is employee focused. It's focused on not just COVID, but more so on the transmission of disease and how people can protect themselves. I would encourage you as employers to take the time to make that available to your employees, or at least pass on what the link is. And if you don't have it, I can give it to Amina and provide it to you. And continue to do those daily, if you can, toolbox talks on your site where you're reinforcing information. As was indicated, we are continually updating those guidance notes. Construction was recently updated. You will be receiving some additional ones shortly. Be prepared. Construction will be visited by our inspectors over the next few weeks, just to make sure and provide information. You can also go to IHSA, as was indicated. What I will do, as I have with in the past, I will keep Andrew and RESCON up to date, as well as the network of COCA, OGCA, and BUILD, with the information as it becomes available, and be open to any questions that you may have regarding testing or some of these innovations that are going to be evolving through the hotspot management and vaccinations. So based on that, thank you for what you do. Be careful and continue to be vigilant.
And we do have a bit of time, so I don't know if you're planning on taking questions, Ron, but Dirk hasn't joined us and we do have some time. So I think we can take some questions. I think some questions are flowing in through Ahead. I think there's one in the chat if you want to start with that, or if other people have questions, now's the time.
Yeah, there's a question right now. Where can we find information regarding mobile vaccinations?
Okay, that's still a work in progress that we're trying to pull together right now. Right now, it's been mentioned, and there's been a few announcements politically that they're looking at that. But perhaps Dr. Heyer would have more information than I do. We're trying to work with public health and the Ministry of Health. I've actually provided information to them saying that the industry is interested in both where there are multiple sites to have mobile vaccination clinics and on-site clinics where appropriate. And we even have work that we're doing with Local 46, where they have a rapid testing clinic in their at their offices, to make those available for vaccinations in the hot zone. So the letter went out to the Ministry of Health on Monday, and I'm sure they're chewing on it. And as soon as I get information regarding what the criteria is, I'll provide it on through Andrew.
That's excellent. Just as we're doing that, I see Darren Hunter. I don't know if this is Dr. Hunter or not. No, I think I have the wrong person. So
No.
I apologize. I'm going to demote you again. Sorry about that. Okay, I don't know if there's another question for Ron, but as I do this,
Yeah.
There is one about the original criteria of 100. We are relaxing that down. Two things that we're exploring right now is, look, if we're talking about 50 or more, where we're talking 100 to 200 tests a week, give us a call. We'll gladly send the information out. We just didn't know at the beginning where we would be right now. So we're doing about 15,000 tests a week. So we do have capacity. We do know that probably within the next month that there'll be even more emphasis placed on small business and techniques to get the rapid testing to small business. But certainly for those that are, below 100 and above 50, we can work with them. And as I said, we're trying to look to the various construction associations that are out there that are more responsible for the little guys of whether or not they can take a pivotal role in getting this out, because the screening is a bridge to the vaccination. And the Ministry of Health has also said that it's also key when you vaccinate to continue to do the testing and screening as well. So I'll get some updated information to Andrew on this as well.
Okay, and then is there any documentation about having a medical condition and can't wear a mask at work? Also, is there a rule that the employee has to provide a letter from the doctor?
I think there's a legal session on this. My understanding is that the employer, there's an issue between the employer ensuring the safety of the workplace, and then there's also the fact that there can be conditions from a human rights perspective that have to be taken into consideration. That there may be an instance where a person cannot wear a mask. They may have to be reassigned to an area where they will not come in contact with individuals, so that they can remain safe, as will others on the workplace. But there is information available from a labor relations point of view that I can also make available to provide that through Andrew.
Okay, and are people required to wear a mask and face shield if you work within 2 meters for more than 15 minutes in a work day?
That's where it's heading. Yes, it is. That's the proper PPE. If you cannot guarantee physical distancing, then proper PPE is a surgical grade mask, ASTM level 1 or above, plus a face shield or goggles.
Okay. And for carpooling, are there any new guidelines for carpooling?
Do it alone. That's the ideal, but that's really not carpooling. We have guidelines that are available. I believe IHSA has guidelines about if it's not only carpooling, but if your construction sites are usually involve a number of vehicles, that wearing proper PPE, driving with the window open, not having more than 2 people in the vehicle at any one time. Those guidance are out there. What we really want to avoid is 4 people in a vehicle with the windows closed, the air conditioning on high, and wearing improper masks and so on. This spreads really easy, so avoiding it is probably the best. If you have to do it, limit the number of people, and keep the cab well ventilated.
And then what would be the requirements for if an employer is interested to have rapid testing? What would be the requirements?
Just send me an email, ron.koleski@ontario.ca. We have a package that we can send out to people that goes through what is required. It is very simple. Essentially, what you do is you sign an agreement, and the agreement says that you will use the testing in accordance with the manufacturer's specifications. You will administer it properly. You will not sell it to your brother-in-law. You will not give it away to your family. You will only use it for the intended purpose. You will report on your findings. And if you sign that, essentially assign that document, that's your attestation that you're going to do all this properly. Then we sign you up to the ordering portal, and you can order a month's supply as an example. So one large general contractor orders up to 40,000 a month, but if they come in boxes of 800, if you were an employer of 50, you're not working on a site where it's already embedded as part of the general contractor, but it's your own shop. 50 people twice a week, you're 100 a week. You could order a box of 800 to last you a couple of months. So it's relatively easy, but you do have to report back and indicate, we administered the 800, we had 15 people that tested positive, and of those 15 people, 8 were confirmed as a PCR, with a PCR as positive. So It is relatively simple. It seems, you know, that it's complicated, but it really isn't. There is a website portal on the COVID-19 where prospective firms that are using rapid screening can actually log in and find out where the resources are to help them test. So there's about 25 companies that have registered on there. So they're the people that would supply, you know, PSWs or would have a supervised group of people that could come into your workplace and administer the tests. We have some of the larger general contractors that are doing it have a throughput. They can put through over 1,000 to 1,200 a day without a problem. We provide it for free. You have to provide the testing on your own. But as we get smarter, I think over the next few weeks, you will see the evolution of this. You'll be able to go into a drugstore on your street corner and buy a rapid screening test and do it yourself. That'll be the evolution of all of this. It'll be like a pregnancy stick, but we're not there yet. We have to follow the rules. But this will become more ubiquitous as we go along. So, you know, my final statement is, you know, even though vaccinations are becoming available, don't drop your guard, wear your mask, follow infectious prevention control procedures, good hand hygiene, because you can spread it and get it even if you've had a vaccine. So I see my colleague, Dr. Heyer, has showed up.
Hello, Assistant Deputy Minister Kaluski.
I was doing the two-step while you.
I figured
you do a quick. If I can do a quick plug, and then I'll turn it over to Amina for proper introductions. The RESCON members put together a rapid testing kind of group, and so we have developed some best practices. So if you are a member of RESCON, or if you're interested and want more information from that group, email Ahead, Amina, or me, and we can help get you what we've done in that little group. But I think it's been very successful, obviously with the assistance of Ron and everybody there. So we'll turn it over to Amina.
So thank you, Ron. And I know there were quite a few more questions that we'll get to throughout the webinar. But thank you for providing that critical information on vaccine rollout for construction workers. And I know we'll hear more from the next two speakers. On that note, our next speaker is Dr. Dirk Heyer. Dr. Heyer was appointed Chief Coroner for Ontario in 2014, and he has been involved in Ontario's response to COVID-19, most recently as a member of the COVID-19 Vaccine Distribution Task Force, where he is also the lead of the Clinical Guidance and Surveillance Workstream. He and his team played a key role in strategizing vaccine rollout with data-based evidence. Dr. Heyer is also an assistant professor with the Department of Pediatrics at the University of Toronto. Thank you, Dr. Heyer.
Good. Yeah, you're welcome, and good afternoon. I apologize that I have been pulled in a couple of different directions this afternoon. As you know, there's a number of things going on provincially and with a number of aspects of COVID. So thank you very much for the invitation. As I joked a little bit earlier, Ron and I work together in various different roles, specifically in my full-time job as a chief coroner. And obviously, whenever we're working together, it's a bad time, but we're really trying to take a lessons learned approach from anything and help to support continuous improvement and minimizing the potential for future significant events from a death perspective or an illness or an injury perspective. So I just thought I would go through quickly some of the vaccine implementation information, just touch on a few things and then open up for questions after that, because there's always lots to learn and lots to think about. And so we can move on to the next slide, please. So I don't think I have control. I presume not. There we go. So just a quick status, and this is as of yesterday. You can see that we have delivered over 3.3 million doses across Ontario, And our initial focus was on those most vulnerable in long-term care and retirement home sectors. And you can see, in fact, in retirement homes, we've done 108%. That's because our denominator was based upon the residents that were living in December. And so that is why we see such a significant number. The good news is that we really have seen a significant improvement in major reduction in illness and notable, almost complete reduction in mortality or deaths in those two populations. We have seen some illness, and every vaccine is not perfect as far as 100% coverage, but by far very, very significant impact and change. We have over the past week about 97,500 delivered per day, but we do have the capacity in place to move up to 150,000. And I'm just going to give the concept of one of the challenges we have, which is that the great thing that everybody wants this, which not everybody, but the vast majority of people are desiring to receive a vaccine. And at the same time, we have limitations in the supply. So what we have is kind of an accordion process where we've sequenced out the delivery, a recommended approach to delivery based upon age and at risk. And I'll talk about that in a minute. And then as the supply comes more quickly, we actually are squeezing the accordion. So we stretch it out when supply isn't so good. And then we have to have that prioritizing. But as we get more and more, the time frame between those different groups is much shorter. So we'll move to the next slide. So this just again is an example of how we have done. We focused on the older age groups because age by far is the most significant predictor of serious illness and death. And so we focused on the older age and have stepped down. And you can see significant vaccination throughout the different age groups as we move through those. As we move through those. We also did focus on First Nations communities that were remote and fly in, and that was organized through the Orange Air Ambulance Service, and 31 different communities have had significant uptake and vaccination throughout those areas. Next slide. This just gives you a perspective of the objectives. So we need objectives for everything that we do, specifically for the vaccine rollout, fairly straightforward. Prevent death, prevent illness, and then prevent transmission. And really, that speaks to the individual role of we want to make sure that those individually who are at greater risk are prevented, that illness is prevented, and hospitalization is prevented, and death for sure is prevented. And as we manage to provide that individual protection to those at greatest risk, then we move down to prevent transmission. Clearly, transmission will be prevented through the work that's done with those that are at risk, but clearly that's the focus. And then we move through to make sure that those individuals who could be at risk are protected, and then move towards reducing transmission. So that's the principles and the approach that we bring. We move to the next slide. And where you can see here is this is our phase 2. And what we did in this particular area is, again, we focused on those at age and at risk, and we drew through the older population, so those above 60, which are the ones that are greatest at risk, and that's where we've seen the majority of our deaths and serious illness. And then beyond age, there are individual risk factors, and those individual risk factors may be because you have a health condition. So those who have transplants, those who have active treatment for cancer, those who have kidney disease, they're all recognized as having a greater risk of serious illness. And so those would equate to somebody who might be in that older age group. So they are individually at risk. And then the second thing is where people might reside, either physically, so they're in their facility they live in, or their actual home, which is a congregate setting, greater risk of transmission, and also some greater risk of infection within themselves. And then there's the hotspot areas, which are historically been identified through the COVID pandemic as being a greater locations disproportionately affected as far as cases, hospitalizations, and death. And there's a number of, we've calculated those or developed those through careful analysis of postal codes and looking at the data and the types of infections that have occurred, and they're distributed across 13 public health units. And those particular areas, as I say, they're recognized as being disproportionately affected. So greater burden of illness numbers within the person, or risk to the person within the community, and then more broadly, they are a very significant contributor to the number of cases that occur and the number of hospitalizations that occur in Ontario. As we've delivered through those particular areas, the aged and at risk, then we're moving towards those who cannot work at home. And those who cannot work at home, who would be provided an earlier opportunity, should avail themselves of those opportunities. So if they fall into the age category that's available, if they have a health risk, or if they live in any of the hotspot areas, they should avail themselves of the opportunity to get a vaccine within those, recognizing all of this is within the context of limited supply. Well, it sounds like we have a lot of vaccine, and we've right around now, I think we're around 24% of the population above age 16 has received at least one dose of vaccine. We still are very limited in the amount that we have. And so we still are waiting for more vaccine to come, because we've had some delays in one of the deliveries of Moderna vaccine. So there are still some challenges, and thus the reason that we have this sequencing. Next slide. So this gives you a schematic view of the different areas. I think I've talked about this already, and thinking about the time frame that we have, I'm not going to spend more time on this, except for just at the bottom, you can see that illustrates how the age and at risk will then move onwards to those who cannot work from at home. Next slide. So this illustrates the hotspot communities, and it shows you just by schematic, by the mapping, to show you that the red and orange are the greatest impact. And you can see that they really focus around the GTHA, as well as out towards Windsor. And really, that is where the majority of these cases are. And there certainly is targeting of those areas to be able to support vaccination. And the way that allocation of the vaccine goes provincially will be population based. So each public health unit gets based upon their population total numbers, with an increase for areas that are identified as one of the hotspot areas. And specifically, there is some additional allocation for those who have First Nations, Inuit, and Métis populations within their jurisdictions as well. Next slide. I think that I've talked about most of this already, but it really is based upon the historic and ongoing. But there also were earlier on when there was testing challenges, and you can remember, may remember in the media, there were some areas of increased testing positivity, but yet low numbers. There were communities at risk that were identified by the government at that point, and those are included in the hotspot communities as well. And they're focused, again, all through postal codes, and the public health units will use their specific knowledge and expertise to be able to deliver vaccine. And those are areas that are somewhat more challenging to provide vaccine to. People aren't necessarily as attending as many mass vaccination clinics. So there needs to be strategies, outreach through community leaders, through faith leaders, through a variety of different mechanisms and multiple channels to be able to deliver the vaccine in the most effective way. The next slide. So this indicates that in the targeted areas, so where they are going out in a multimodal channel, such as a mobile unit or a clinic that's being set up in a particular area, or one that might be developed in partnership, and I'll talk about this in a minute, in partnership with a workplace clinic, all of those areas will be able to provide vaccine in those hotspots to anyone 18 and over. Because what we know is that there's multi-generational families living in homes, and there are certainly risks of infection and also risk of illness, and many people within the targeted high-risk areas are also people who are cannot work at home, and important that we effectively provide vaccine across all ages in the immediate delivery, but they aren't able to book those through the provincial booking system. I did note in the comment that anybody over 55 right now can book in pharmacies and get AstraZeneca vaccine. Speaking from experience, it's a good vaccine, I'm confident, and many of us have availed ourselves. It speaks to my age now that you know how old I am. And then, as you've written in here, I mean, the over 60 can book through the provincial booking system. The next slide shows you that actually over 50 years old, so it's not on this slide, over 50, you can also book in the hotspot area as well. This is what we've been working on recently, which is on-site vaccination clinics. We're looking at all kinds of different modalities and different channels to be able to provide vaccine in areas of hotspot. And these are where a workplace may choose to provide a vaccine hub or a vaccine location, working together with public health units, working together with others to develop an on-site clinic. And the criteria that we've been talking about, and there still is work in progress. It's not that just you sign up and you get it, because there still needs to be vaccine supply and there still needs to be access to the system that keeps track of all of the vaccination. But the criteria's initial consideration is it's within a hotspot community. There has been an outbreak within the facility. The clinic will vaccinate the employees that cannot work from home, but also will vaccinate those that are in the community area. And that allows the fact that there would be a benefit for both the employer, but most importantly, benefit for the hotspot in making sure that we provide the vaccine to all of those that are at risk and who need it. The employer would also take on the responsibility of doing the operating and funding and working together with others to make sure that they are effective. And as you can see in this slide deck, can certainly be shared. There is an email address, and it is monitored, and people are setting up not only for right now, but also thinking about how to set up for when we get past into phase 3, where there'll be hopefully lots of vaccine available and people providing the vaccine, not necessarily as a clinic site, but also specifically for the employees. So there will be thinking about that needs to happen as well. And I think that's the last slide, if I recall correct. Yeah, so let's leave that. So well, we can go off the slides and we can go to the questions at this point.
Okay, so now we'll take a few questions. So a lot of employees are concerned about, and they're skeptical about the vaccine. So what do you tell employers who have employees who are skeptical, and what should they say? And like a follow-up to that, is there a difference between different vaccines? Like, does it matter which vaccine you get?
Yeah, great question. So vaccine confidence is an important thing to always think about. And what I encourage people to do is to listen and then to hear about those concerns. Some of those concerns may be very straightforward. So I don't think you need to be medical to answer the question that your DNA will not be changed by these vaccines. So that's very straightforward. It is a question that's asked a lot, and people who haven't heard about this, I think giving information that these have been fully evaluated through the normal process of safety evaluation by Health Canada, and that there's ongoing evaluation that we're doing on a regular basis to make sure that if there's any safety concerns, those are fully evaluated. So these are safe, effective, and very helpful vaccines. All the vaccines that we have available right now, we haven't got Janssen in Canada, but AstraZeneca, Pfizer, and Moderna, all the vaccines have been shown to provide significant protection from serious illness, from hospitalization, and from death. Some have a greater percentage of protection from any illness, and those numbers vary between the vaccines. But what I tell people is take the vaccine that's available to you now, because they all protect from serious illness, hospitalization, and death. And that is going to be important for you individually, but also important broadly for the province to be able to reduce the challenges that are associated with the pandemic, reduce hospitalization. And as you probably all know right now, the intensive care units in the hospitals are really completely filled with people who are quite sick, and really individually we want to protect, but then more broadly. So I think, and then then specifically, there are a number of resources available. I think that having a conversation with their physician, reading, looking on the website if they're up to doing that work. I don't know if people have occupational health and safety groups. They could learn more and provide, act as a specific resource to the employees to think through this when there are more specific medical questions.
And did you get the vaccine?
Yes. Yeah, I'm about 3 weeks out, and I had AstraZeneca, and I'm about 3 weeks out. Again, it tells you my age because at that point it wasn't even down to 55, and it was. I had side effects, which was a bonus. I was really happy. Side effects are good. Just it's a weird kind of thing to think about, but side effects means that your body is working to develop the immune response, and so I was quite pleased that I had side effects.
Okay. And can construction workers working in an identified hotspot get a vaccination? And if so, what's the process and what's the proof that they need to show?
Yeah, we have a low barrier approach to a testing or proving that you're an area. And if they are living or working within a hotspot area and there's a vaccination site or clinic in the area, they can attend and they can be provided that vaccine. Again, there aren't a lot of sites up right now. This will come over the next number of days and weeks as we have more supply. So it's two messages. It's let's go and let's get everybody in those high risk areas done, but we don't have the vaccine to get them all done right now. But we are targeting and focusing, in my view, in the most important areas, which is the age and then those areas of greater risk. And so when construction workers would be working in those particular areas, that would be because, again, there is potential greater risk that might be present within that area. Again, I'm not going to pretend to know exactly the individual construction types because it would vary by how far, how outside, how close you would get intersecting with those within the community where the risk might be. So I think it's thinking about all of those things to make individual decisions about balancing off the protection you might get, but also the risk that you might have, and then recognizing there's others that might be at greater risk to think about where do you stand within that particular area and particular line of thinking that through. So it's a long answer to the question, but I think it's important that everybody thinks about when you make decisions about the vaccine, multiple things are considered.
Yeah, and somebody else asked also if they don't necessarily live in a hotspot area, but they work in a hotspot area, like so they can't work from home and they work in a hotspot area, but they don't live there. So what can they do? Yeah,
so we have it's live and work, live or work in that hotspot area are entitled to the vaccine within those particular areas. If there's an area that they like a location that they can go to, that would be logical. For example, if a site set up and I'm not saying this would happen, but if a site set up a clinic that was the hub for the community, those people who attended the site would be able to be vaccinated at the same time within that site.
And then there's another question. If they have seasonal workers who will be coming into Ontario from other provinces, will they be eligible to get the vaccine here through, even if they don't have an OHIP?
Yes. Yes, that absolutely is. And what we are doing for temporary foreign agriculture workers that are attending from other countries, we've set up a vaccination process that those who are arriving now, not necessarily last month because we didn't have it in place, that at the airport, they are receiving their first dose of vaccination.
Yeah, somebody asked, what were your side effects?
Side effects? Yeah, so I had a sore arm. And then during the day, so I had it at about 11:30. During the day, I felt great. And then in the evening, I felt kind of a little bit of muscle aches and I was a little more tired. Ron would say I'm tired all the time, but I was a little bit more tired. And then I had a little bit of a little shivery and went to bed, slept like a rock. And then the next day I was fine. And the next evening I had some chills for a period of about half an hour before I went to bed again. Took Advil and I felt great with the Advil. So I would describe those as minor side effects, but certainly they were like I was getting a virus. And so similar to what your body would do to respond to the virus. We have seen some reports of very rare side effects, and they really have dominated the news with AstraZeneca. And those very rare side effects have been observed in younger people. and very rare unusual blood clots that are associated with low platelets, which are the clotting factors in our body. Those are being analyzed very carefully. And this is a challenge with with a safety, a thorough safety analysis. So we recognized in the world, out of 25 million, we recognized about 100 and something cases of this clot out of 25 million. But it meant that everybody looked at it very carefully. But then there's the challenge with that is, as we implement what medically is the right thing to do to answer those questions, then the public messaging, unfortunately, has led to people having distrust of a vaccine that is very effective. And there are risks in everything that we do. That doesn't, I am not minimizing the effect on that individual person, but there are risks in anything that we do in medicine. And we need to make sure that we understand those risks in the most effective way, target the vaccine in the most correct in avoiding any potential elevation of that risk. And so what happened was the Canadian medical officers and experts limited the use of the vaccine to over 55 while they continue to do the studying. Health Canada just came out now and said they're not going to change their safety approval on this, but we still have experts called the National Advisory Committee on Immunization, who are the ones that recommended the 55. They're still looking through other data from the real world data, and they'll provide their further analysis as to whether 55 is the age to use or not over the next coming days.
Okay, and just last question, is there a requirement for a worker to self-isolate directly after receiving a vaccination? And if so, for how long?
The only reason you would self-isolate is if you're exposed to COVID-19, the actual infection. The vaccine does not have any live virus. There's no virus in the vaccine whatsoever. What it does is it provides, it essentially has the body produce a tiny protein that's the same type of protein that the virus has. It's not got the virus in it. It's not got anything to do with the virus except that little piece of protein. And then the body reacts to that protein and makes antibodies because it recognizes the protein as not being part of you. It identifies it and it develops its process to get going and be ready to go and infect when something comes in with that protein on it. So if the virus comes into me and I get exposed, then the protein will be identified and my body will say, get out of here and stop that infection. So that there is no reason to self-isolate or to worry. What we don't know is we don't know yet whether the vaccination of any of the three prevents from people still becoming infected. They may not get the symptoms, they may not suffer problems, but they're not infected. We don't know if they're infected, and then they would potentially still be able to transmit it. So that's why even after vaccination, there still are everything Ron was talking about, the 2 meters, the mask, the goggles, and Ron and I have different goggles each. Like we all got special goggles that we use when we're out and about. We kind of look cool in the different ones we have, but it really speaks to the need that we still have to have the public health. We're doing continued study on the effectiveness of preventing any illness. And there's been early information from some of the vaccines that it prevents transmission altogether. Let's hope that's where we get to, but it still is a bit by bit.
Yeah, I think that'll be it for questions. Back to you, Andrew or Amina.
Thank you, Dr. Heyer. I would just personally like to reiterate points that you and both Andrew made about getting the first vaccine that you are eligible to receive. As we all know, that vaccines are our first line of defense in the fight against COVID-19. So thank you for sharing that information. And I know our attendees were very grateful to have you answer a lot of their questions. So thank you.
You're welcome. Unfortunately, I have to drop off, but I know that Dr. Kaluski can carry the rest of the conversation quite well as he did earlier, if that's all right with everybody.
Well, and just so that everybody knows, Dr. Heyer literally had a half an hour break, and instead of taking time off, made himself available for this group. So if we can give him 4 minutes back, that'd be nice. But can't thank you enough for all of your efforts in making the time to talk to everybody here. I'll give it back to him,
Yeah. Well, we're all working together on this, and it's just so thank you for honestly, thanks for the opportunity and the honor of being here.
Thank you.
Thanks, Dirk.
Our next and final speaker is Michael Sherrard of the labor and employment law firm Sherrard Coos. Michael is recognized as one of Canada's leading employment and labor lawyers and is the former chair of the National Labor and Employment Law section of the Canadian Bar Association and the Labor and Employment Law section of the Ontario Bar Association. In October 2020, the government of Ontario appointed Michael to be chair of the Skilled Trades panel. Michael is acclaimed for his broad range of expertise, strategic excellence, and ability to identify and broker agreement in the most difficult of circumstances, and his specialist knowledge of union contract and negotiation issues. He is the recipient of several awards, including the Construction Institute of Canada's Chancellor's Award of Excellence, the University of New Brunswick Alumni Award of Distinction, the Canadian Inter-University Sport Lester B. Pearson Award, and the Canadian Franchise Association Volunteer Leadership Excellence Award. Welcome, Michael.
Thank you very much for the introduction, Amina. Andrew, if we could go right into the agenda, please. So over the course of the next 25 minutes, I'm going to try to cover the 5 headings here. It'll be a bit of a repetitive message that started with Andrew today in terms of it's not time to slack on with respect to all of the different pieces we've learned over time with respect to what we need to do on a construction site to take care of each other. So that's that first bullet, extra vigilance, back to the basics. I'm going to talk about vaccination policies because, as you've heard our 2 previous speakers speak about, as they roll out and now as they also start to engage employers in this, having a vaccination policy, I think is you have to start there, I think, and it's really something that's quite critical to rolling forward. And in the vaccination policy, we're going to talk a little bit about how you collect the information. What do you do with it? How do you keep it private? What kind of controls you may want on it? I'm going to try to give you 2 or 3 slides on takeaways with respect to what you want to have in your policy. And then because of the announcements over the last couple of days, I'm going to try to give you some quick tips and some good websites we think that will be quite useful if you're an employer and you're starting to think about operating an on-site vaccination clinic, because there are employers out there that are already up and running in Ontario that have done it, not necessarily for their employees, but in their communities. And there's some great lessons to be learned there. And it looks to being somewhere between a 2 to 4 week process in terms of getting it up and running. So from the previous speakers, you've got some lead time in terms of if you're interested in trying to do that. So let's move from there and let's just look back at the basics just to cover some things off. I thought Ron made some great points, but these are the ones that we all know about, but we need to go back and relook and make sure that we're actually vigilant and we're actually still carrying these out on our sites and asking our workers. Ron's great point about toolbox talks. We need to keep raising these issues because as we look around, lots of people are not necessarily following the kind of practices that we need to have and public health is recommending to us. So the importance of self-monitoring, we want to reaffirm with our employees the kinds of things we want them to do with respect to answering the screening questions, staying home if they have symptoms. That's a difficult one, but that's easy and important advice, frankly. The cleaning and disinfecting that's going on in the workplace, we're still doing at a variety of workplaces, we're still seeing deep cleans being done with people. Having sufficient resources on hand, and I think Ron, our first speaker, mentioned that as well, going back and looking at your supplies and saying, well, this isn't a 3-month affair. We're in this for quite a long time yet. And so do we have sufficient supplies, not just hand sanitation, but masks? And then his comment, just to be repetitive again of Ron, his comment about it looks like the science is now evolving to where the mask isn't going to be sufficient. And so there's some great proactive advice to start to look at goggles and or shields. I think that's really important and a good heads up that all of us should be taking into consideration. And then the points around the social distancing, and what we're hearing most on construction sites where they're still seeing problems are on rest periods, breaks, smoke breaks, meal periods. And then Ron gave some great advice, just to be, again, repetitive on purpose. If you are carpooling, trying to have no more than 2 people, if at all possible, still using PPE, having windows open as opposed to closed windows. And thank God we're getting into better temperatures where that may work. So if I was doing this slide again, I'd be amending that last bullet now to put in goggles and shields. And so if you think of this, this is all about all of us on this call, the listeners going back into your workplaces and continuing your leadership, staying informed, sharing that information, and then staying up to date. And lots of people are asking about how do we stay up to date? And our advice so far at our firm has been, in RESCON as an example, the hosts today have been providing great resources in terms of the links that you're seeing in the chat box right now. In between, the Ontario government has had great resources, as has the variety of public health organizations around the province. So really good to go back to the basics and try to find a way to reconvince people that as the vaccine rolls out and a greater percentage of us get it, still important to maintain all the protocols that people have implemented thus far. I'm somebody who got a vaccine this morning, believe it or not, in terms of part of this rollout. Still means we're still going to be using masking and distancing, all the hand washing techniques. It's not a time to let our guard down. So if we can go to the next slide, please. And then we keep going, because now we're going to talk about some of the legal considerations around vaccinations. So first and foremost, the biggest question I think that continues to come up is, can we have mandatory vaccination policies? And some people will say, yes, you can. Our advice has been you can, but there are a lot of issues that may arise if you're trying to have a mandatory vaccination policy for your employees. So what we've been advising is, number one, you've got a vaccination supply issue. Number two, you've got concerns about the various vaccines and the newspaper coverage juxtaposed against the comments you heard from Dr. Heyer just earlier. And so we have to spend a little bit of time, one, on availability, two, on what are the benefits. Obviously, the clear science is it's going to assist us with protecting the health and safety of our employees, let alone our societal population. And again, the more people that can be convinced and educated and talked to, and I mean that, reasonable conversations with people who either have fears or actually have potentially human rights based concerns or privacy based concerns. And we want to try to make sure that we try to address those. So as you think of these considerations, if we move to the next slide, now we go to, do you put a policy in place or not? First and foremost, the best advice we think is, yes, please put a policy in place. Consider whether or not mandatory makes any sense to you. And if you're considering mandatory, then consider all of the other elements. And I'm going to go through some of those this afternoon as we go through more slides. But very important to think about, is there a methodology by which we can teach, educate, resource credible sources for people to allay their fears and actually persuade them in a reasonable manner that the vaccine is a good thing and it would be important for them to get vaccinated. In your policy, you need to consider, let's assume you're going to go with our advice and you're going to have a general vaccination policy, encouraging people to get the vaccine. You then need to think about what are the consequences for non-compliance. And for most of us, we've said non-compliance, the consequences should not be disciplinary. So the old days of, you know, somebody gets terminated or somebody is suspended, those are not the kind of consequences that you want in this policy. The policy should be constructive and accommodating. And really clear that you get your policy together now, even though we have limited supply. Part of putting a policy in place is communicating it effectively with your workforce in advance of its application. There are some differences between a unionized workforce and a union workforce as it relates to these policies, but I'm going to try to just stick with the unionized workforce at this point. So if we move to the next slide, we'll see a little bit more about what the human rights risks are that we have to worry about. So if you have a mandatory policy, so everybody must be vaccinated, you're at risk of violating the Human Rights Code. And you see this on this slide, and it may be that a mandatory policy actually violates the Human Rights Code in specific instances. So somebody comes forward with a medical related disability, and we've heard a number of conversations around what that might be, and or a religious belief. So those are two issues we have to watch out for. And again, if we step back for a moment and just forget legalese for a moment, there's a significant difference between asking our workforce to undergo a rapid antigen test, taking fluid out of the body, as opposed to taking a vaccine where we're putting fluid into the body. I think people generally, there's a heightened sensitivity and emotions, frankly, around the vaccine. And so our advice has been, there are some circumstances where you can make it mandatory. And let me give you those. They're quite narrow. I think the circumstances are where you have what lawyers will call a bona fide occupational requirement. And so for many of us in this topic of vaccines, you're really looking at where somebody is caring for a vulnerable population, as an example, long-term care homes. That's probably a place where there's a pretty good argument that there's a bona fide occupational requirement that the workers get the vaccine mandatorily. But as you've seen in the press and coverage so far in our province, I'm not sure that's even the case. And certainly both levels of government, both federally and provincially, are not giving mandatory vaccination advice in terms of, we want to rule this out and we want to make it mandatory. What you're seeing is, as much as possible, education to the workforce. There was a question in the chat box at one point that said, would it be useful to have some kind of a survey to gather information from our workforce to understand the kinds of things that are barriers or concerns that may prevent somebody or have somebody decide not to get a vaccine? I think it's a great idea, anonymity in the survey, but then you can at least target some of the educational resources around why a vaccine is a good thing and potentially be able to satisfactorily address some of your workforce population with respect to why it's worried about getting a vaccine, and potentially have them in a position where they will now go get it voluntarily. So again, in your policy, make sure that we're looking at accommodation of human rights-based rationales for not getting a vaccine. If we go to the next one, this is the framework, the legal test that people think about, especially in the unionized workplace. So you don't have a policy today, you're thinking about putting a policy in place, and let's assume it's going to be a general policy as opposed to mandatory. What the Kvp test is, it's 6 parts. It says, is your policy consistent with your collective agreement? Is it a reasonable exercise of management's rights? Is it clear and unequivocal? Has it been brought to the attention of the employees? Have you notified workers that a breach of the policy could result in? We wouldn't advise discharge, by the way, but you need to be very clear in terms of what the outcomes are. And is it being consistently enforced? So again, to emphasize, even though it's on the slide, we're not advising people that a breach of the policy leads to discharge. That's probably back in the long-term care, very narrow circumstances. And I don't think we're going to find that we have sufficient circumstances in construction to make it mandatory. It's going to be a very difficult one, but we'll see. Things can change. And that's, your first speaker said, let's keep up to date. I think where we sit today, it's very difficult to see a mandatory policy that's going to actually work, as opposed to a general vaccination policy, excuse me. So when you look at these 6 steps, some of them are really easy, right? It is easy to write a policy that is clear and unequivocal. It is easy to bring the policy to the attention of your employees. Not so easy to make it consistently enforced. It sounds easy, but it's not, but it's really important that we do. And in terms of assessing how it is consistent or inconsistent with the collective agreement, that's simply your HR professionals or potentially your lawyers looking at what's in your specific collective agreement as against what your policy says. But those are the 6 points you want to be thinking about as you start to look at it. So let's look at one, for example, is it reasonable? And that's on the next slide, where we'll say, and I'm trying to pick up on that mandatory policy for a moment. Is the policy aiming to protect a vulnerable population that can't be vaccinated or for which the vaccine is less effective? We know we have some science on that. with respect to our seniors at a certain age, ergo the rollout that the doctor just took us through in terms of why we targeted older parts of our population. But again, very hard to squeeze this in and make it fit for construction. Again, scientific evidence, what's out there with respect to what are the proper ways to prevent the transmission of this disease. And what we find on that next slide is some of the things that actually undercut the ability to make it mandatory. And so first and foremost, we have been, all the science so far is telling us that proper and consistent use of PPE is considered effective in stopping the spread of COVID. Now, some listeners may be saying, has Sherrod actually looked at the stats in Ontario? I absolutely have, but the science right now is still saying, and remember, as the science updates, almost like Ron's comment, maybe the mask isn't enough, let's now move proactively to goggles and face shields. I noticed a question about the safety glasses that have sides to them and so forth. I don't think there's been an assessment yet as to whether they are effective and therefore will they be compliant with respect to if there's a change in guidance. My guess is from that question today, Ron won't miss that. When we see guidance, I bet you there's some clear guidance with respect to will side shields be enough as opposed to a set of goggles. So again, as we look at some of the points on this slide, really what we're talking about is current practices being sufficient to contain transmission. And some of it really is, that's why we're seeing a blitz. We have practices, are we all following them? Are we getting tired? And I mean, everybody must be able to admit we're getting tired of this, given how long we've been in it. But we need to go back to those basics on that first slide. And lots of our health and safety professionals on this call are well versed in what really needs to be done to continue this. If we move from there onto the next slide, the next thing I also think people want to think about is if you're going to collect information on who in your workforce has gotten a vaccine or not, let's think about why you're asking. Is there a rationale? Because there will be privacy implications for the employer who collects that data. We know, for example, if you've gotten your first vaccine, as an example, that the government is using a COVAX web, I'll call it a web, that's really not the right way to put it, but that's the collection tool to keep track of who has gotten their first vaccine and when the second vaccine will roll out. But we do have employers contemplating hanging on to that information. And if you do so, we want to be very careful with respect to how we do it. And we want to communicate to our workforce why we want to know who's been vaccinated and not, and think about the reasons for it. Remember, public health is saying, when you get your vaccine, it doesn't change the PPE requirements. And we know people today who have gotten a vaccine and who have tested positive subsequently for COVID afterwards. And so that science is evolving, but today we know the directions and the advice from public health are still saying PPE is still critical, distancing is still critical, contact tracing will still occur. Here are some things for the future state that might be more compelling, right? For example, if I'm as an employer prepared to pay people for time off to go get the vaccine, again, there's not a legal requirement, but I think it's highly advisable. If you can encourage your workers to go get the vaccine, I think that all pays off in the long run. And if you happen to be an employer who is going to actually host a vaccination clinic and go to that work, then I think, again, we should think about time off for the workers to be able to be processed through that system. If we move to the next slide, this is just a list of privacy things to consider. Make sure you're only collecting the information for a legitimate purpose. Make sure that it's secured and only accessible to somebody who actually needs the information. That's a very narrow set of folks if we think about who in our employer executive or potentially health and safety official or a human resource official. And then also, how do we get it? How are we going to communicate our intention to destroy the information once it is no longer required? If we move to takeaways, let me give you a few of those. Again, before implementing the policy, and there's been a little bit of case law on this, when you're looking at the reasonableness of the policy, if you go back to KVP, the reasonableness of the policy sometimes can be affected by what you as an employer have done in advance of putting the policy in place. So have you taken proactive steps to encourage voluntary compliance through education of your workforce? Have you actually considered incentives? And we've had lots of discussion around incentives to incent people to go get a vaccine. Again, voluntary, not mandatory, but incentives. And we think there are lots of different things employers can do that will be found to be lawful by way of incentives. Next, when you think of best practices, consider the benefit versus the risks when you determine your policy, and communicate that in your policy. It's very important, we think, to have in place in the policy very clear indication that you are prepared to address anyone's disability that might warrant them not getting a vaccination, and or any religious belief that might warrant them not getting a vaccination. Very important to have that in the policy. If we move on, you'll see considering including alternate options. So you want to actually put in place, here are some things to think about if you have a human rights based belief in terms of why you don't want to get the vaccination. Here's what I, as the employer, will do as an alternative option. And again, that's really critical. And again, the last one's pretty straightforward. Let's get our policies in place and let's publish them now, in advance, as far in advance as possible. And again, they become not only a policy that gets posted, we get our leadership trained on it. We talk about the policy in the toolbox talks, so that it is, you're cascading your message, but it also has to be repetitive. If we go to the next one, please. So the other thing I think is really important is if you're in a unionized workplace and you're putting a policy together, I think it behooves us to engage with our union partners and talk to them with respect to their thoughts and their input. I think that's really critical to the success of the policy and everybody participating, because remember, at the end of the day, the objective is, can we encourage, cajole, incentivize people to go get the vaccination? Talk to people about the purpose of the policy. Why are we doing it? And remember that balance Ron talked about, the balance between our health and safety objectives and our human rights responsibilities as well. Enforce the policy consistently. And then we say council, I think it's human resource professionals, health and safety professionals, employment and labor law lawyers should be able to assist as well, both in drafting the policy, but in some of the training. So now let's look at this topic that really came up earlier this week, employer operated on-site vaccination clinics. So what we've heard so far, and again, I said earlier, there are examples already out there where employers are hosting vaccination clinics. But again, so far the examples have been so as to assist the government in the rollout in their communities for community citizens as opposed to their workforce. You're going to see that evolution, but great best practices already exist. So the partnerships right now, what we've been seeing is it becomes a partnership between public health units, hospitals, and private medical providers. So employers, as an example, who are looking at this, I think we did hear earlier in the presentations, the employer will be responsible for providing a fair bit of not only the site and the administration of the site, but in fact as well medical professionals. We understand public health units might supplement these employer-led clinics, but it really is for the employer to resource and find medical practitioners to assist. And Ron talked about the regulated health professionals in terms of that change in the rapid testing piece. Again, stay tuned in terms of what the requirements are for an employer-operated vaccination clinic. They'll be looking for employers where there's been a history of outbreaks or hotspots in a community when they're trying to figure out where they're going to do these. And obviously, we're going to be focused on employees in these new ones. But my understanding is the purpose is also to provide support for vaccinations in the community in that location as well. Lots of employer responsibilities. But if we go to the last and final slide on this, what I tried to do is grab a bunch of the resources that we think will be very helpful links for any employer who's interested in looking at an employer-hosted vaccination facility. And so you'll see these links, I commend them to you. And there's been some great best practices. And I think what you're going to find is Ontario employers who are already up and running in this are going to be quite sharing with respect to their information as leaders in our community. And as this comes online, I think you'll see more resources, and we'll start to fill in what many people right now are saying, okay, well, wait a minute, I've heard about this, but there's so many unknowns. Those are going to shrink. And in fairness to our government, they're catching up as they're trying to roll out this concept, both either at an employer site or in mobile clinics. And I think our industry is an industry that's led so far and can continue to do so. And I think we'll see more information over time. But that's where I'm going to stop. I'll try to answer some questions before we wrap up. But I'm hoping these links will actually help anybody who's thinking about an employer-hosted clinic.
Yes, and we'll move on to questions now. Could an employer be held responsible for adverse reactions to vaccines administered in the workplace, or by promoting the vaccination of to its employees?
Yeah, I think people are quite worried about that, but we've got two places that really help you. The first one is workers' comp coverage, if it's considered to be in the employment situation. That's number one. But number two, we also have the federal government who have talked about a program to cover off this kind of an issue. So I'm not sure there's liability, but even if I'm not sure and we move to what are the risk mitigation moves? The risk mitigation moves are clarity with respect to the policy, clarity with respect to if you're actually going to host it, and what you're saying to your employees with respect to your expectations, and then default back to workers' comp coverage and that national program.
Okay. Government mandates masks be worn full-time. No, sorry, not this one. Do you think we can ask about vaccination status for new hires?
It's a great question. In a non-unionized workplace, number one, I think you can ask about vaccination status if there's a rationale. And so we default back to that bona fide occupational requirement, that term that people use. But again, I think you have to be in a workplace where mandatory vaccination is something that's required given your workplace. I think it's going to be challenging. So a bit wishy-washy in the answer. I think you can ask, but we want to think about why am I asking and what is the outcome? What's the result if somebody says to me, for example, well, no, I don't have the vaccine. Well, can that be a rationale to not hire? I think that's a dangerous area to get to right now. I wouldn't advise people not to hire on somebody's status as not yet vaccinated.
Okay. How does this masks need to be worn full-time inside a workplace? How does it apply to an outdoor environment such as a job site? Can the builder enforce mask wearing on a full-time basis?
It's a great question. I think I go right back to public health, right? Like right now, I've seen lots of employers using quote unquote best practices to say wear the mask. And I think I heard our first speaker say, you might be considering now things more than simply a mask. And so some of the case law talks about the science doesn't have to be exact. In other words, we don't have to already know the correct answer. There may be an answer that says it's reasonable to take these extra precautions because we're not yet certain. So again, I think it depends on the circumstance. Is the construction site a place where there is complete air circulation and so forth? But my advice, I default to safety. Let's wear the mask. Let's now start to think about these face shields and/or goggles. I think it's important to be more precautious now than simply saying, can I get away with not doing something? I think Ron, I'm hoping, would come on and say, no, we want to encourage people to wear masks and now potentially goggles and/or face shields.
Correct.
Okay, and if a fellow crew member refuses to work with an unvaccinated crew member, what can an employer do?
Well, I think, let me switch the question just a little bit. Let's assume somebody says, I refuse to work with Joe Smith because Joe Smith isn't vaccinated. I think currently today you have a process you have to follow on a work refusal, but I don't think at the end of the day, if the employer is following and having all its employees adhere to proper infection control systems, so like the little pieces, the masks, the hand washing, the distancing, all of those kind of things, I think an employee is going to be hard pressed to have what will be seen to be a reasonable work refusal. I don't think that will be a reasonable work refusal, at least in today's current science.
Okay, and so if somebody does not want to get a vaccine, even if there's no religious or disability or human rights centered reason, do we accommodate their wishes or try positively to move them in the direction of getting the vaccine? Example, by rewarding through time off.
Trying to encourage them, trying to reward them with some time off to get the vaccine. I think those are all great ideas, and those are the ideas I'd look to, as opposed to some kind of disciplinary response. I'd still spend a whole bunch of time on education and in reasonable means to try to persuade them to go get a vaccine. I'd spend a lot of time over there as opposed to disciplinary consequence.
Okay, and then Ron, do you have any last comments that you'd like to make regarding the questions?
No, if anybody's interested, just Google my name and put flu shot behind it, because 20 years ago I ran the paramedic service in Toronto when they introduced mandatory flu shots. And, it was a really tough time. People were very emotional about being told that they had to have something. But the good news is 20 years later, when the vaccinations came out, those same paramedics were standing up saying, we want our vaccination now. So this is, as was mentioned by Michael, education, information, consistency of education and information is really important. There's a lot of myths out there. So trying to direct people to get the right information, credible information, will certainly help you in dealing with someone who is afraid or speculative when it comes to the use of the vaccination.
Thank you, Ron and Mike. I'm going to turn it to Andrew to make some closing remarks, unless there were any lasting comments from Ron or you, Mike.
No, I'm good. Andrew, jump in.
Yeah, no, and I think today was incredible, and I don't think we've ever had kind of interaction like this between trying to monitor the chat and the questions and answers. It's a very active group, and I think it goes to the quality of the speakers we had. So just a big thank you, Mike, Ron, and Dr. Heyer. As we always do, we make a donation when we do these events instead of giving any kind of gift or thank you to the speakers. And so because the day of mourning is coming up with respect to the WSIB, we're going to continue to make donations to the Threads of Life. And I think everybody here knows about that group, and maybe Amina, I'm putting you on the spot. If you can put a link to their website in the chat, that would be much appreciated. But essentially, Threads of Life provides supports when there is a workplace fatality to that workplace or to that family who's experienced it along with the individual. So they do incredible work, and they deserve to be recognized for it. I've thanked the speakers. I'd like to thank them again. Not only are they great speakers, they're great in what they do. And so Ron, Dr. Heyer, and Mike, really appreciate your efforts. It looks like we're probably going to do a fourth COVID event. I don't know what the theme is, because obviously in the fight against this pandemic, everything kind of changes. And so we want to change with it, and we want to have the answers that members are looking for. I think today's event was phenomenal. I think some of the things that I heard coming out of it, I think we nailed the title with, protect, vaccinate, and communicate. So I think that's good. And I think if you can take three things away, that's what you need to do. It is also very clear the Ministry of Labor is going to continue to do their part. They're going to create and update resources, but they're also going to inspect and enforce. And that's what they're there to do. And we're thankful for their role in that. As these resources become available, we're going to send them out. Other construction associations will send them out. And one question that has been answered and we didn't really answer is why is RESCON and why are experts on here advocating to exceed requirements in labor law or in collective agreements or essentially go above what is the minimum requirements of the law. And I think the answer is it's a global pandemic. And what we want to do is we want to foster an environment where people are looking for solutions instead of looking for problems. And so this pandemic requires efforts from labor and management, but also from government. And if people come to the table with the attitude of how do I make the situation better and what can I do to help, that tends to produce a lot more solutions. And so as employers, just like we did with rapid testing, which is voluntary, if we can go above and beyond, it sets a great example for everybody else to go above and beyond. And I think certainly in Ron's role as the Chief Prevention Officer, I don't know if there's anyone in the province who's going above and beyond any more than Ron is, and right up there with him would probably be Minister McNaughton. And so we've got great leadership out of government in this file. As health and safety leaders and as associations, we have to go above and beyond. And I think that's why when it comes to incenting your workforce, working with your workforce, doing the things that aren't required under your collective agreement or labor law, but that you can practically do, those are the things that make a difference. And those are the things that will increase the vaccination rate. And those are the things that we're hoping will increase compliance. Mask use, mask wearing is still a huge issue. There was a question that we didn't get to in the chat, and I'm not a labor lawyer, but a mask is PPE. If you're on a roof and you don't have fall protection, you don't have a harness, you can't be up there. You can't be doing your job. I don't view a mask as any different. And so we need to take masks and PPE related to COVID-19 seriously. And I think as employers, it's up to us to set policies. It's up to the workers and unions to follow and promote and buy into those policies. But as employers, we can make that first step, and we've got to work in partnership with the government and with unions. And I think that's why we're doing what we're doing. Amina has shared a lot of resources in the chat. What we're going to do is we're going to take all of the slides, we're going to take this recording, we're going to put it all together, we're going to take all those resources, and we're going to get it out to everybody who's here today. I can't thank everyone enough, including Amina and Ahid, who do a lot of the work behind the scenes. I'd like to thank all of the other construction associations who were part of this and who also are doing incredible work in this space. I'm going to stay on for a couple minutes, and I'm going to try and answer the remaining questions that have been put forward. But I think this is it for this event. We'll probably have another event in a couple months, but thank you to everyone, and thank you to the health and safety professionals, including the Joint Health and Safety Committees. It's easy to come up with the answers, it's hard to implement them. And so this pandemic is all about implementation. And that really comes down to the people on the ground and on site. And I just can't thank you enough for your efforts. If Mike or Ron want to jump in with any kind of final thoughts, other than that, I know we went a little bit over, but just thank you, everyone.
Thanks, Andrew. I do have to leave. Thank you, Amina and Michael, for this was very well done. Maybe the fourth one can be light at the end of the tunnel.
I like that idea. That's a great name too for the event.
Take care, everyone.
Thank you.
Good. Thank you for having us. Take care.
So great work, everybody.